Lecture 1, Bio 550, Human Anatomy. Welcome to Bio 550, Human Anatomy. My name is Shelley Brenholt and I will be the instructor for this class this semester. I'm very excited to be teaching this class and look forward to working with each and every one of you, both online and face-to-face when we meet during our on-campus sessions. My goal for this class is not only for you to learn the obvious structures of the human body, such as the bones, muscles, nerves, and organs, but I would like you to gain an appreciation of the amazing design of the human body as a creation. I'd like you to understand and see how we are all similar, but yet very different and individual. Learning anatomy can be like learning a new language. Depending upon your learning style, you may learn best by repetition. Activities such as rewriting your lecture notes, re-listening to portions of the lecture, spelling out structured names, or pronouncing terms out loud over and over may be helpful. When learning the bony landmarks and muscles of the body, I would encourage you to engage in being an active learner. You may want to draw structures on the whiteboard with markers if you have access to that, or you can laminate your handouts and use dry erase markers to draw structures over and over on the laminated handouts. You are encouraged to palpate structures on yourself, friends, and family members. Another way to engage in active learning is to try to teach what you've learned to others. Ask questions, answer questions on the discussion boards of your classmates, and use whatever learning style fits best for you. Never hesitate to ask questions, and I encourage you to answer each other's questions through the discussion board on Angel. Our first topic will be anatomical terminology, planes, and axes. Please refer to your lab manual for this lecture. You will find the content in the introduction section. Anatomical position is the position of the body when it is standing, with the palms facing forward and arms at the side. This position is used when describing one body part in relation to another. It is important for you to understand lay versus anatomical terms and when to use them. Lay terms are typically used when communicating with patients or non-healthcare professionals. Anatomical terms are typically used when communicating with healthcare professionals or when naming structures of the body. Understanding anatomical terms will enhance your ability when naming structures throughout the semester. Your lab manual has a list of the structures that you will be responsible for knowing in both lay and anatomical terms. Be sure that you are able to find these regions on yourself and your classmates. The skeleton is subdivided into axial and appendicular parts. The axial skeleton consists of the skull, the spine, including the sacrum and coccyx, ribs, and sternum. The appendicular skeleton consists of the girdle bones, which are the pelvic girdle, including the ilium, ischium, and pubis, and the shoulder girdle, including the clavicle and scapula. The appendicular skeleton also consists of the limb bones, which are the upper extremity bones, including the humerus, ulna, radius, wrist, and hand, and the lower extremity, including the femur, tibia, fibula, and foot. Be sure that you are able to identify the bones or groups of bones of the axial and appendicular skeleton on yourself or others. Next, we're going to talk about terms of direction. Terms of direction are used to describe the spatial relationship between one structure or region of the body to another. These terms should be used relative to the body being in the anatomical position. You should be able to identify the terms and use them properly as described in your lab manual. The terms cranial and caudal are used on the trunk only. Cranial means toward or near the top of the head, whereas caudal means toward or near the lower vertebral segment. An example of using cranial or caudal would be, the cervical spine is cranial to the thoracic spine, but caudal to the head. Proximal and distal are terms used only on the limbs. Proximal means toward or near the attachment of the limb to the trunk, whereas distal means away from or farther from the attachment of the limb to the trunk. An example of using this terminology would be, the elbow is distal to the shoulder, but proximal to the wrist. One would not say the cervical spine is distal to the head. Superior and inferior are terms that are used either on the trunk or the limbs. Superior means toward or nearest the top of the head, whereas inferior means toward or near the soles of the feet. So one could say the knee is distal to the hip, but could also say the knee is inferior to the hip. The terms external and internal refer to parts of a hollow structure. External means the part or parts of a hollow organ or bone nearer the surface of the body, whereas internal means that part or parts of a hollow organ or bone farther from the surface of the body. Other terms of direction that you will hear and need to be familiar with are anterior and posterior, medial and lateral, superficial and deep, ipsilateral and contralateral. Be sure you are familiar with all the terms of direction listed in your lab manual, as well as their application. Planes and axes. Planes and axes are again described relative to the body being in the anatomical position. A plane is an imaginary flat surface. An axis is an infinite line that passes through the plane. Movement occurs within a plane around an axis. Each plane is associated with a particular axis that is oriented perpendicular to the plane. The sagittal plane passes through the body, dividing it into right and left segments. Coronal or frontal plane passes through the body, dividing it into anterior and posterior segments. The horizontal or transverse plane passes through the body, dividing it into superior and inferior segments. The medial lateral or ML axis is associated with the sagittal plane. The anterior posterior axis or the AP axis is associated with the frontal or coronal plane, whereas the vertical axis or longitudinal axis is associated with the transverse or horizontal plane. For a movement to occur in a plane, it must move in the same direction as the plane. For example, in the sagittal plane, this divides us into right and left. Therefore, the movement occurring in the sagittal plane must be either forward or backward, such as with hip flexion or extension. The frontal or coronal plane divides our body into anterior and posterior segments. So the movement occurring within the frontal plane would be movement straight up or straight down, such as shrugging your shoulders. The horizontal or transverse plane divides the body into superior and inferior segments, allowing for movement to occur that is parallel to the floor. Such movement would be trunk rotation. You will be able to express which planes a joint moves in and which axis it moves around, as well as the names of the movements taking place in each different plane. For example, shoulder flexion, the movement occurs in the sagittal plane around the medial lateral axis. Use the examples in your lab manual for practice. In this class, we will learn specific muscles, their attachments, the nerve innervation, and the actions they perform. The concept of muscle line of pull will help you understand why a muscle performs the action that it does. Muscles cross over the joints of our body to allow movement. The joints of our body have axes that pass through them to allow movement to occur within the associated plane, as we discussed earlier. The number of axes that pass through a joint is largely dependent upon the shape of the joint. The relation of a muscle or its tendon as it crosses an axis determines the action of that muscle. It is the relation of the muscle to the axis at the point of crossing and not where the muscle attaches that determines the function of the muscle. The attachment of the muscle, however, influences the position of the muscle or its tendon to the various axes it crosses. So, if a joint has a medial lateral axis, a muscle or tendon that crosses that medial lateral axis anteriorly or in front of the axis will move the next bony segment anteriorly. A muscle or tendon that crosses the medial lateral axis posteriorly or behind the axis will move the next bony segment posteriorly. An example of this is biceps brachii at the elbow joint. The elbow joint has a medial lateral axis that passes through it. The biceps brachii lays anterior to that axis and therefore flexes the elbow. If a joint has an anterior-posterior or AP axis, a muscle or tendon that crosses the AP axis superiorly or laterally will move the next bony segment superiorly or laterally. Whereas if the muscle or tendon that crosses the ML axis inferiorly or medially will move the next bony segment inferiorly or medially. An example of this is the superior fibers of the deltoid of the shoulder joint. The shoulder joint has an AP axis where the superior fibers of the deltoid cross over that AP axis superiorly, causing the shoulder to abduct. In the wrist, the flexor carpi radialis muscle is lateral to the AP axis of the wrist and therefore will radially deviate or abduct the wrist. A muscle or tendon that crosses the vertical axis anteriorly or medially will move the next bony segment medially. A muscle or tendon that crosses the vertical axis posteriorly or laterally will move the next bony segment laterally. An example of this is the adductor longus muscle of the hip that crosses the vertical axis anteriorly, therefore medially rotates the hip. This concept may be a little bit difficult to grasp at first, but we will continually go through this concept as we discuss the muscles and their actions throughout the course.